Hello everybody, it's Monica Heltz with your weekly Fishers Health Department review. Today is Tuesday, January 12th. The biggest news for today that I am excited to report is that today was our first day of COVID-19 vaccine. So we gave Moderna vaccine today in our clinic, and there is nothing so amazing as being able to be a part of this solution to this global problem and to be able to get shots in arms. This is how we get ahead of this. And as a nurse, it was amazing to see people in person. As a public health professional, it was amazing to be able to be offering this primary prevention. One of the cornerstones of public health is immunizations, and to be able to offer this finally for our people is where we want to be. So we want to ramp that up as quickly as humanly possible. We are putting all city resources behind this and trying to do everything we can to make this happen as fast as possible. This week, we're only able to do 200 doses, and that is based on our allotment from the state. Next week, we hope to do 600. We received more doses from the state for next week, and then going forward, we're requesting up to 1,000 doses a day for our new site, which we hope to open in a couple of weeks. That site will be at the Old Marsh at 116th and Brook School Road. You may have seen some activity there. You may have seen the press conference or the news about that. We are excited to be able to hopefully get as many people through there as we possibly can as soon as we have those vaccine allocations coming from the state. And we do hear that those are supposed to be coming, the gates are widening, so we're really excited about that. You may have heard on the news about the CDC recommending that everyone 65 and up be vaccinated. We've had a lot of questions in our hotline about that. I can tell you they did recommend that. However, we still have to follow the state's plan, and right now the state's plan is for 80 and up. We do expect that they will open that up to 70 to 79-year-olds pretty soon, but it is not yet open. I would encourage you to complete our vaccine interest survey. That is how we identify people on the homebound list. If you need a homebound delivery vaccine, or if someone you love does, you can complete that for them. Or if you want to be on our standby list. So we are actively using the standby list. We called 4 people off of it today to use up those remaining doses. We have to use up all 10 doses in our vial. And those individuals were able to come in and get vaccinated. We are calling down based on the next risk group as identified by the State Department of Health. So right now we'll be calling 70 to 79-year-olds. So please do have your phone ready if you fall in that age group, and you may hopefully get a call from us. We'll send out those numbers so that you can program into your phone and expect where they're coming from. Regarding our community transmission and our risk rating, that is still in red. No changes in our color coding from all of the metrics this week from last week. We are very firmly in red. All of our primary criteria for community transmission risk are in red. Our percent positivity rate is 24.2%. Our Fishers Health Department site is at 15.9%. Our case incidence rate is 94.03. That has been increasing for the past 2 weeks, basically since the dip since Christmas. All of those are very much in red. Also, just as we predicted last week, the county, Hamilton County, has gone to red on the state's metrics, so that carries some additional restrictions under the governor's orders that you can refer to there. No real change for Fishers because we had aligned ours previously, so our gathering sizes, everything, if you're paying attention to that, no changes there. Our public health capacity remains good. We have our testing availability quite good, less than 1 day, so you can get an appointment the same day or the next day. We've got lots of availability in our school testing site ready for any possible opening of schools. We have our turnaround time is good. Most people are getting results back in 1 to 2 days. Sometimes we have outliers of 3 to 4 days. The average time for turnaround across all of our Fishers residence and testing facilities is 2.7 days. So we're going to keep that in yellow. Our tracing capacity remains green for Fishers Health Department. We're able to get a hold of about 80% of people within 24 hours. And do that full tracing. Our State Department of Health has stopped actually calling people who have been identified as contacts. They are entirely relying on text messaging. However, the Fishers Health Department is still calling all of those folks. We are less successful at getting hold of you, but more successful than the state. So we will still make those calls. For that reason, I'm going to keep us in yellow. Our hospitals remain stretched. Our ICU bed capacity is at 20.8%. No significant change. Maybe looks a little bit better, but still in a danger zone. Hopefully we won't see those overflows now that they're getting the healthcare providers vaccinated, and we seem to be managing things okay. Hopefully we won't be in that kind of dire, drastic situation, but we are still monitoring it very carefully. They still are going in and out of diversion. So in summary, as far as news from last week to this week, we do know that we've seen some data from our contact tracing that shows that self-reported exposures are higher, show higher rates of in-home transmission. We've seen that for some time. Most people are reporting that they got infected in their home or at someone's home. A lot of that, of course, is if you get infected somewhere else, then you bring it to your home and you infect everyone in your home. So we know there's going to be a higher percentage of that, and that primarily is due to what we call secondary transmission. So you got it from somewhere and then you gave it to all of your family. That's a secondary transmission. Where did you get it from, though? So that would be our primary transmission source. We aren't 100% sure of that. It's hard to exactly get at that if you don't know where it got infected. We're working on some more sophisticated modeling. However, one of the indicators that we do see is that Hamilton County, as I've mentioned before, has very high rates of mobility. And when we compare our mobility to our year before mobility, so pre-pandemic mobility, we know that we are traveling about at just under the same rate that we traveled last year. So we have not significantly decreased the amount of places that we're going to. So we have not been hiding in a hole all that much, and it really has not been significantly different from where it was last year. And that tells us that there is a pretty high chance that people are getting infected out and about in the community. So if there are ways that you can decrease your risk when you are out and about, like let's say don't bring your whole entire family when you go shopping, just take yourself, just like we did in April, so that you are decreasing the chance that you're going to catch something in any kind of unnecessary exposure situation. So that's what we're wanting to eliminate, is unnecessary risk, unnecessary exposure situations. So that's still our advice. Continue to mask, continue to distance, continue to hand wash, be excited for the vaccine, be listening, be ready when your time comes, fill out the interest survey, sign up on the standby list, and we will get through this thing together. Thank you so much for listening. Take care, everybody.